I want to welcome you to this panel. I'm Blanca Ortiz-Torres. I'm a professor at the University of Puerto Rico, Rio Piedras campus. Dr. Patricia Noboa is there. She's an associate professor at the University of Puerto Rico in Cayey. Dr. Domingo Marqués is on my left. He's an associate professor at the University Albizu here in San Juan as well. Francisco Aquino, who's on my right, is a doctoral psychology student at University Albizu and a lawyer. And Dr. Torres, he's a research associate. He's over there at the Center for Puerto Rican Studies in CUNY. And Yésica Nieves, she's a psychologist at Gouveneur Health with the New York City health system. Both Yésica and Lionel are alumni. Lionel from the University of Puerto Rico, Rio Piedras campus, and Yésica from Universidad Carlos Albizu. Welcome. And as you know, all of us will present some brief remarks for approximately 5 minutes, and then we'll have a discussion or reactions among the members of the panel, and then we'll open up for a discussion, focusing basically on recommendations, suggestions that you may have. Since Hurricane Maria hit Puerto Rico, I have been involved, besides surviving and devoting many hours a day to guarantee basic needs, in 2 main tasks: exploring potential academic collaborations in 2 universities, the University of Connecticut and Trinity College, and working in interdisciplinary teams to provide psychosocial care to those in need of it. While conducting my explorations in UConn, I met Charles Venator, who invited me to present our work in this conference, and then I invited the colleagues that are here with us today. I thank Charles and the Puerto Rican diaspora and Alice for their support and their invitation. I would like to begin my talk by quoting Bimak and Chong, who have stated that following a disaster, psychological defenses are disrupted, normal social support networks are frequently in chaos, and normally helpful connections to stabilizing life markers are severed. Furthermore, a sense of psychological and physical safety is shattered, leaving one to reconstruct meaning, purpose, and relationships while taking care of basic survival needs. We will describe psychosocial interventions we have been conducting in shelters and communities severely affected by Hurricane Maria. Patricia, Francisco, and myself are part of an initiative organized by the Puerto Rican College of Physicians and Surgeons soon after the hurricane hit the island. 10 groups were initially organized, composed by physicians of several specialties and nurses, and at least 1 behavioral professional, which could include psychologists, psychology students, counselors, or social workers. Following Bimak and Chong model, we have conducted brief targeted interventions, mostly focused on developing a sense of safety for individuals and families and promoting social connections. The groups have visited more than 30 cities and towns, working at the individual, group, and community levels. As a community psychologist, I would like to share with you my assessment of the general psychosocial situation most people have been facing in shelters and communities. Maria has revealed with crudeness and cruelty which are the most vulnerable sectors in Puerto Rico: women, sexual minorities, the elderly, migrants, and children. These are the groups most represented in shelters in cities like Guaynabo, Las Piedras, Humacao, Maricao, and others. Women who are head of families and their children. Pregnant women who had received little or no medical attention during their pregnancy. A transgender woman who was not able to get her psychotropic medications nor her hormones to be able to transition into a woman. Elderly who lived by themselves in shanty houses, and children of all ages, including 15-day-old babies. Staff in most of these shelters is not trained to respond to the complex dynamics that affected people's faith in this kind of emergency. In some shelters, we saw representatives of several agencies, such as the Departments of Housing, Family, and Health, among others. No coordinated strategies to provide services to those sheltered there. A typical day in a shelter is disorganized, unstructured, and idle, except when the President of the United States was in Puerto Rico for a couple of hours, and many in Guaynabo shelters were bused to a church to attend an event where he was speaking. Maria revealed that the health system is fragmented, with little or no attention to contextual, economic, or psychosocial variables. The interdisciplinary experience in our group was new for many of its members, who only now are aware of the importance of responding to the diverse needs individuals and families have, particularly in scenarios such as those we are now living. Under this effort, assistance has been provided to more than 2,500 people, but we're still getting requests for help and intervention. We're still following up some situations we found in the shelters and are now moving into community. Right now, I'm working with some community leaders and a group of my community psychology students in the San Isidro community in Canóvanas. This area was occupied, some call this invasión de terrenos, 25 years ago, and only recently got the infrastructure for electrical power, which of course is out of service since Maria, and was in the process of getting the water system installed, process that was stalled because of Maria. Many of the residents in the community are documented and undocumented Dominicans and have only received services from religious organizations and our team. No garbage disposal services have been provided by the municipal government since Hurricane Irma, who was previous to Maria. And residents report at least 4 deaths due to leptospirosis. We will collaborate with community leaders to reorganize and refocus their efforts to move into sustainable community development. I now will turn to Dr. Noboa. Patricia.
Can you hear me?
Yes.
Thanks, Blanca, for inviting me to this panel. I want to share with you 2 experiences that show the process of loss and grieving that we are living in Puerto Rico. I do not pretend to reduce the complexity of the trauma by talking about just 2. Instead, I want to highlight in some depth the process or dynamics at play in the life of two women. The first woman was around 65 years old. She is married and has an adult daughter. She and her husband are fishermen, and they also had a fish shop. I met her at the church. She was handing out coffee for those who were waiting to be seen by the doctors. I greeted her warmly and tell her, Elisa, how are you? How is this leader? She looked at me surprised and asked me, how do you know my name and that I am a leader? I tell her, this is written in your name tag. She looked at her chest, laughed, and started talking with me. She told me how hard and difficult was the hurricane for her. She names all the things she lost. Quote, I lost my clothes, my shoes, my washing machine, my dryer, my car, my fish for sale, and the refrigerator where I put the fish. Immediately she said, "Those are material things, they do not matter. At least we are alive." I answered, "Is that so?" This question moved something in her body and she started to cry. Immediately she said, "I cannot cry. Here they need me. I must be strong. I cannot get lost." I tell her, "Tell me more about what you lost." She started telling me about the bed that she lost and how losing it has forced her to sleep out of her house. She had to sleep at the church parish, and for her, she is invading, quote, she is invading the Father's house, and she does not want to feel she is invading. She doesn't want to bother. She told me all of this crying and full of grief. I think it is important to underline how the superego functions in her, that dimension in her that supports Puerto Rican cultural demands. Those cultural demands on herself are, number one, she's a strong woman who resists crying. For her, crying is a sign of weakness that can make her lose her mind. It is important to mention that she had received prior psychiatric treatment as a consequence of losing her job. Now I ask myself, what kind of psychiatric treatment did she have? What is only pharmacological treatment? During the treatment, was there a space where she could work on all her losses, not only her work? The second cultural demand on herself that I noticed was that she has to be attentive. She has to respond to the needs of her family, her community, and others. However, she seemed to refuse to see her own needs. And when they are addressed, she experienced this with anguish. Now I ask myself, have others noticed and attended to her needs? Particularly, how did her father assume and attended to her needs? The second woman was approximately 50 years. She has a son. She became a widow 2 years ago, and her daughter and her mother also died around this time. In other words, she had 3 significant losses in less than 2 years. I met her when I approached a group of women who were talking while waiting to be seen by the doctors. I introduced myself and told them I was a psychologist, and if they want to talk to me, I was available. One of them said, "Oh, that's great. I have a daughter that needs so much." Interestingly, the psychology is good for others, not for oneself. One of the women stood up and came to me, sitting by my side, and I asked her, "Did you come to see the doctor?" She said yes, and started sharing with me that she has a leg that does not respond. That when she wants to move the leg, it fails and she cannot move. When the leg fails, she cannot move and makes her stop. And she cannot stop herself. I asked her about her family. She started talking about her daughter, that for her she was an angel. The child had an intellectual disability. She said that since her child was born, she left everything behind to take care of her. For her, she was a very special. When her daughter died, she was in the hospital, and her husband, a cancer patient, was home. Her husband never knew about the daughter's death because when she came back from the hospital, he was already dead. She told me, but I go on. I go on forward. Then I have to take care of my mother. Her mother had a cervical cancer. What surprised me from her story was how fast she narrated all her losses. For me, that rhythm marks the way she responded to those losses. I must go on forward. She did not talk about her losses by Hurricane Maria. She talked about her previous losses, her big losses. Maria provoking her the necessity to talk about her significant losses. And her unconscious, through the symptom of her leg that does not move, make her stop, make her slow down her life rhythm. These two women, like other Puerto Rican, had lost something they loved, something they desired. As a psychologist during this community intervention, what I have done is open a space for people to talk about their losses. My invitation to my colleagues here is to open a space so that they can symbolize and elaborate those ties, bonds, and objects they lost before and after Maria. This work will help them grieve and generate hope and create a sense of future in them.
Thank you, Patricia. As I said, Francisco is a psychology graduate student and a lawyer who's working with us in this interdisciplinary effort. Francisco.
Hi, moving a bit to the side here. Hello, so Patricia and Blanca, they have both, Dr. Ortiz, they have both captured really well what we've experienced in the communities, both the sense of personal loss and what the feeling that prevails when we visit the places that we visited, the community outlook, the losses they've had. I want to take us back a bit, back to 2008, to try to demonstrate, how these communities were before the hurricane and talk about what they're going now. So I want to focus on that. So back in 2008 in Puerto Rico, there was a community called Barrio Boca that was opposing an expropriation procedure executed by the municipality. For those of you that are not familiar with the expropriation procedures, the concept of expropriations or takings, that's the action through which the state takes property from the owner for public benefit. It can be to build a road or a park, but that was not Barrio Boca's case. This community is close to the sea, and the mayor wanted to take the land so he could use them, so he could sell them to build luxury housing developments that he called tourism developments. He didn't hold back. He used the police to threaten the community members. He entered their homes without warrants and cut power and water services. The mayor is now behind bars for this and other corruption schemes that were discovered later. But to fend off the dangers of losing their homes, we had to fight. I say we because back then I was part of a pro bono group that helped communities at risk of displacement with legal strategies. I was still in law school and had never done this type of collective work before, and was astounded by the pressures and the sheer size of the stakes these people had to face. This isn't the only community in Puerto Rico that confronts these kinds of burdens for many different reasons, and the mental and emotional strains their members suffer are crippling. Back then, I had not encountered the concept of resiliency. Today, I hear it too often from students in my postgraduate clinical psychology program to government officials. For example, recently, I was talking to a student who told me that a community I had visited about 3 weeks ago as part of the interdisciplinary group that we've been aiding, had to be made more resilient because they depend too much on external aid. They had to be made more resilient. The community we're talking about is called Punta Santiago in Macau. It is also a coastal community. You're bound to find many coastal communities in the island. After Hurricane Maria passed, the municipality accompanied them for the public refuge, from the public refuge to their homes. And when they arrived, many people found they had lost everything, including their cars. Some lost the roof of their houses and were sleeping on wet mattresses. Others were left with a plot of land where their house used to be after the sea came in and took it. Punta Santiago is removed from where commerce in the municipality mainly happens, and they needed help to access basic necessities like food, water, and clothing. When we face these circumstances, comments like they have to be more resilient seem a little bit designed. This and many other things that I hear or read have made me reflect about how psychologists, public health workers, and government officials talk openly and amongst ourselves about the impoverished communities here in Puerto Rico. On the one hand, we seem to be aware that many of their problems stem from inequalities that are social in nature. But on the other, we use concepts like resiliency to reflect blame back onto them for their shortcomings. As a quality, resilience is positive. It is toughness, the ability to recover quickly from difficulties. As psychologists, we work with clients to build this dimension of themselves when they need it. But when weaponized, resiliency becomes an incapacitating rhetorical device, and it is up to psychologists to point this out and confront it. Strength can only get you so far. During this crisis, a group of attorneys under the name of Post Maria Legal Support in Spanish have been helping communities that lack the resources and knowledge filling out FEMA forms for disaster relief and giving free legal advice. After reforms are filed, FEMA gets in touch with the homeowner through a telephone call to let them know when an inspector can go and see the damages to their homes. However, FEMA's inability to have Spanish-speaking representatives widely available through the phone has hindered and greatly increased the anxiety of people that have not had access to learning English as a second language fluently. So what we're seeing here is also a lack of quality education as a social product that has affected people's ability to bounce back and rebuild. From my perspective, for us in Puerto Rico, this catastrophe has meant that clinical psychology must refocus to give much more weight to community building within the psychotherapy process. As psychologists, we have a fundamental role in helping people work through trauma and depression to build resiliency in a way that does not ignore the social dynamics that they are subject to, and that is not directed at accepting or tolerating the injustices that diminish their quality of life. For us as professionals, it must motivate a willingness to get involved in public policy issues. Having said all of this, the people I recently met in every community show an incredible post-Maria resilience. Though they suffer mentally and emotionally because of their terrible losses, most have no doubt they will come back from it. La playa se levantará, said the people in Punta Santiago, that the beach will rise again. From what I've seen, with the adequate interdisciplinary help, I have no doubt that will be the case.
Thank you, Francisco. Now, Domingo, let's see if you can. Okay. Domingo will now describe the work he and his clinical psychology students have been conducting in several isolated areas in the central, mostly in the central part of Puerto Rico.
Hello. I want to start with an observation of what Francisco just said, and from what we've gathered in our interventions, we've seen some of that. You know, resiliency, using this term as something you can just gain in that, like, you know, because you need it right now, so you must be resilient. Resiliency, you don't build it because you're told to do so. Resiliency depends on pre-trauma variables that are already there that either make you more vulnerable to trauma or stronger to trauma. Everybody's been exposed to trauma in Puerto Rico. 100% of our population has been exposed to trauma. So in normal circumstances, at least 20 to 25% of us will develop PTSD. That's it. So, and that's at least, because I want to make an observation, just so we can all really get the extension of what we're going through. We've all gone through really bad things in our lives. Definitely, losses of life, divorces, loss of the job, etc., storms, hurricanes. We dealt with that before, especially in the Caribbean. We're ready for hurricanes. It's part of our routine in a sense. But no one could have gotten ready for this, because this is a catastrophe that you can not just go and make an extension of what you've experienced before and really acknowledge or understand it, because there's no way you can understand this. I mean, we're talking about loss of life. We're talking about loss of drinkable water. We're talking about loss of power, loss of communication, loss of freedom of movement, loss of security, loss of all the infrastructure, loss of predictability. That's the most important thing. Right now, not the government, not any leader, not anyone, anybody in Puerto Rico can really say what's going to happen tomorrow, or that something is solved or under control, because it's not. It's like you never know when water is going to go. You never know if the generator is going to work. You never know nothing. So it's all about unpredictability right here. So the whole society is going through trauma. And not only that, but it's like the bottom has dropped out. It's like the fundamentals and the basis of our society. It was gone in 12 hours, basically. So the government or anybody could have not been ready, because they weren't ready for the loss of communication, for example. We had a hurricane in 1998, which was strong enough, and we lost power for like 50-something days. We lost water, but guess what? Back then, everything was landline. So the banks worked, the phone worked. It was really different. So that's the situation we're dealing with. So my team was contacted by the Army, some special forces, that they were working on getting through the most isolated areas. And they wanted help from psychologists, because they expected trauma reactions from people, and also they wanted us to help with the red tape and the bureaucracy while gathering information from politicians, mayors, and people on the emergency management units within the towns and the municipalities. So we helped a lot with that. And the main areas were in the most rural areas where they had the most needs. So we worked with them to help with the reaction of the people, and we also worked with some firefighters back from the US, from California and Louisiana, that came in and helped like opening the roads, because we had a bunch of different places within these towns that people were cut off by mudslides, by whole like roads were overrun by rivers. So you had like whole communities that couldn't just get out. No one could get in. So we saw, like pregnant women in their 8th or last trimester, like already bleeding. We saw dialysis patients dying basically because they couldn't get any, not only get out, but even if dialysis patients got out, you had no power in the hospitals to do the dialysis with the machines. So it was really difficult. So insulin, we had some diabetes patients in the mountains without their medicine, elderly people all alone with no food at all, flooded houses. So we saw everything in terms of what you can endure. And also, like within those towns, you had a lot of people that would build their houses in spaces that you shouldn't, next to the road, next to the river, so the mudslides just would overrun their whole houses. So that's part of what we did. And before we were called by the Army to help with that, we prepared our patients in the clinic, because we also have programs that work with suicidal patients. So we did a lot of work pre-hurricane with them to cope ahead, and not to the magnitude that we had, but we did anticipate loss of power, loss of communication. So what we had is that vulnerable people were more vulnerable now. And what happens is that they don't have access to the many things that they could use to cope. For example, going to the beach, talking to my mom, there's no communication. Going to the movies, there's no movies. you know, going to grab something to eat that you like that doesn't exist anymore. So it's about, you know, survival. And what we found when we were really worried about our patients, and a real interesting observation we made is that our suicidal patients prone to crisis, we're talking about 10 or more hospitalizations, suicidal attempts. We deal with borderline personality disorder and really, really crisis-prone patients. They were like the best behaved in their families because they have coping skills. They did it coping ahead. Not in every case, but what we saw, we're talking about 4 programs all around the island, and we saw that they were even better than their families in terms of that. So my last point is that since we've all been exposed to trauma, we actually need to get some assessment out there and some interventions, because even in our patients it works, so it should work with other people.
Thank you, Domingo. And now we move to New York, and we'll ask Leonel from the Centro to please present what you've been working on.
Yes. Well, first of all, we are speechless. In fact, we salute you for all the work that you have. You can hear me?
No.
Oh, okay.
We can.
To raise my voice, okay. Okay. First of all, we are speechless. We definitely salute you for all the effort that you have been doing. So we are very thankful for that. As you know, we have been in the silence for so long. From the diaspora, it's been weeks, and most of us have been experiencing different emotions. Exactly, there's no right or wrong when it comes to how we feel, and not knowing what happened with family member has been difficult. It's been really devastating for some of us. We can only imagine not being able to talk with our friends, family members, you know, hearing, estoy bien, mijo, no te tienes que preocupar. As Puerto Ricans, we miss the island more than ever. Nevertheless, historically, we are becoming more conscious about our role here in this brave new world. We have to remember that the event was a natural phenomenon, but it became a disaster, a humanitarian crisis. As fellow citizens remain in the dark and without the most basic needs, including healthcare. In addition to an ongoing crisis, due to the financial debt that we have been having, as psychologists, as healthcare professionals, we have been receiving Puerto Ricans in the states, across the states. And those who were able to travel, most of them perceive themselves as refugiados, which have great repercussions to anyone's side. We have been seeing this in the news, the term of being refugiado, refugees, but we didn't expect it to be so close to us in the past few weeks. Fleeing from our country as safety remains uncertain, a sense of being unable to return to our daily life because we have to worry about what can we do today to keep the lights on. There's so much to be done as trauma echoes within the life of many Puerto Ricans, many with severe chronic illness and with much needed attention. First, I would like to briefly list some of the things that the city has been, the leading efforts that the city of New York has been doing. The city has established a service center located at Centro Cultural Julia de Burgos here in the Upper East Side for any one of us from the diaspora or from the island who come into the States. They can receive information about mostly everything, social services, health insurance, schools, even healthcare. It's open from 9 to 5, and there is also a similar effort in Boston. For more information about all similar efforts across the states, we have some representative from a website, and a really great effort led by Victor and Suhey that is called Diaspora por Puerto Rico. So this is some of the flyers. If you want more information, I will introduce you to them. They have more information about similar efforts across the states. When it comes also to the New York City Health and Hospital Corporation, they also have been receiving patients with priorities for Ricans. Of course, that's why we have my colleague, Dr. Nieves, is going to speak about more in detail about all the efforts that the city has been doing. And I will talk specifically about one of the satellite clinics that is part of the public health system. It's called the Roberto Clemente Family Guidance Center. For those who wants to get to know, this is one of the remaining clinics that is fully bilingual. Here, they have been also receiving patients from Puerto Rico. They have a group of therapy led by Dr. Ocasio Jaime Clan. They specifically address some of what we have been hearing from our colleagues back in Puerto Rico. And of course, we have been encountered some relevant barriers when it comes to care that are not necessarily addressed or talked, but I think this is really important when it comes to receiving Puerto Ricans to the States. Certain considerations we have to consider the mental health prescriptions, psychotropic medication, for example, across the state. They have different regulation, more strict than others. The city of New York is one of them. And here, for example, the use of benzodiazepines is really regulated. Of course, right now we have an opioid epidemic, and this is a public health concern. And when we receive Puerto Ricans from Puerto Rico, they already have their prescription, right? And some of them have been using as a long standard treatment benzodiazepine, for example, clonopin, or other similar medications. Here in the States, the therapeutic dose for that is 2 to 4 weeks. Here, there in Puerto Rico is a long-standing treatment. So these inconsistencies are really important to address it once we receive patients here. So we have to talk about it to see how can we work this out when it comes to changing maybe the psychotropic medication. Also, we have to consider the withdrawal symptoms. Some of them will already be here and they don't have the refills, or they have not received services for this kind of treatment. So we have to follow up with the refills. Specifically, if those who have problems with, who are lower income, we strongly suggest to fill out the refills with local pharmacies here, not the big pharmacies, which can lead to lower the cost. And also, we have, which leads us to secure communication with the providers back in Puerto Rico in order for us to follow up with treatment. So we have to continue these collaborative efforts between the island and the mainland. Of course, finally, we still have to work to do when it comes to bridging our efforts and consequently build the linkage for Puerto Ricans as a result of the crisis. Thank you.
And finally, Yésica will tell us about her work with the New York City Health System.
Good afternoon. I want to start just saying that I am really grateful for this opportunity of being part of this panel. As many Puerto Ricans, in 2015, I decided to move to New York. And it has been a struggle for me to adjust. So what is interesting is that it was not until September 22nd, 2 days after Huracán Maria, that I finally understood I am in New York and I am not in Puerto Rico. I am part of the diaspora. So I felt alone in the train. I felt desperate. And actually, those kind of emotions is what we can expect of people that are relocating in New York or in other states. This desperation, this loneliness, helplessness, and even more this sense of loss and sense of guilt of leaving the island in this moment that is so crucial and important. Leaving friends, family, careers, houses, you name it, right? So for example, today here in the audience, I have my parents. They arrived 2 weeks ago from the island. My dad is a multiple sclerosis patient, so he depends on infusion that is done on a monthly basis. So it has affected me personally, and I am using this experience that I see in my family as a motivation to try to understand how, as a professional in mental health, I can help patients at Gouveneur Health. This is part of New York City Health and Hospitals system. And this has been triggering me a lot of questions about my cultural identity and who we are and what we need and how can we help each other even at the distance. So I think that it's really appropriate actually to talk about resilience as this ability of the human being of face and overcome adversity and then to be strengthened by this adversity. I totally understand what Francisco brought into the discussion about we cannot blame people for how they feel or what is happening around them, right? But I do understand that we need to let our patients know that they do have some control on the way that they're coping with this loss that is so terrible. So I am proposing to start a group named Renacer Boricua as part of Gouveneur Health and our Latin Bicultural Clinic. It is a 6-session intervention focused on the promotion of resilience. I want patients to understand that they can access these skills that they have had to use in the past to overcome adversity. Of course, Maria is unprecedented, but we can look back in our lives and see how we have overcome other issues in our lives. So we need to assess their spirituality, the sense of self-efficacy that they have, how they are problem solving, how many support they have from their families and friends. And I think that even more important than just emotional support that is so needed, we need to educate the patients about their own, ability to overcome and give meaning to this event that is so tragic for our island. I am already using this intervention in individual therapy with some of my Puerto Rican patients. For example, I have a 75-year-old woman who came in 1 year ago with anxiety-related symptoms. And even though she was being stable and is in the maintenance phase of treatment, all of a sudden, of course, she's feeling really anxious. She's suffering from insomnia, and she is actually ruminating a lot about her son who is in quebradillas. And even going to church, which was a coping skill for her before, is not being enough for her. So I have been using the sessions with her to stabilize a little bit her mood so she can actually see that there's hope, which is the most important thing. And that's why we are all here. We want to find answers. And I also have been doing this kind of approach using resiliency as my guiding light with another patient. And with this, I want to end in a positive note. So he's 62 years old. And he has been working in New York for 10 years. And finally, he was gonna go back to the island. And it's difficult for me not to be emotional about it. I'm sorry.
And that's okay.
Thank you for listening. This gentleman, 62 years old, has been saving all his money to go back. And all of a sudden, December is not a good goal. You know, he was planning to go back on December, and his family is from Arecibo. So we have been trying to look back in his life, how he has managed traumatic events in his life, struggles. And just in this week's session, I assess how is his resiliency at the moment. And I am using Edith Henderson's Bradford model for resiliency. This model talks about personal resources and external resources that can foster resilience. And it's really powerful because it talks about I am, I have, and I will, right? So I started the phrase and I just wanted to hear what he was gonna tell me, right? So from all the questions, from all the trials that I did with him, he finally came in, and you guys are gonna cry now. He said, I am a Puerto Rican. I have the skills to help, and I have the money to help, and I will help my family and anybody who can access me and who can talk to me, right? And then he finally said, I am Puerto Rican, and I am proud of being Puerto Rican.
Bravo.
So this is just it was just a couple of examples of how I am trying to use this concept of resilience to focus on the internal resources that we already have and trying to make sense of what is happening as a diaspora member. Thank you so much.
Thank you. We were supposed to have some time for discussion amongst ourselves, the members of the panels, but I think that we better open the discussion to all, everybody there, including us, if you want to, because we only have 30 minutes left. So we open it to your ideas, suggestions, questions.
One member of the panel, I'm sorry, of the audience have a question.
I have two questions. First of all, I want to thank you for your presentation and the work that's being done in terms of crisis intervention. My interest is actually patients that are in the dark right now and who have suicidal ideation, what's being done about that. And the other piece is for those who have a dual diagnosis, co-recurrent disorder, you know, mental illness as well as substance abuse. What's being done in that area?
In the island or here?
Both.
Blanca.
Domingo will get that question and respond.
Well, first of all, there are different levels in terms of the answer because you have the Department of Health, which is not doing much. Sorry to say that in terms of coordinating anything within the first month to get the help out there. In terms of suicidal, there's no assessment at all in the shelters or in the you know any help that's going out there. The main focus was on supplies in terms of food and water and medicines. I mean, that was it, and safety. In what we've done is that I've inserted like students, doctoral students within the Army units, and they were doing some assessment about that and trying to coordinate some help for them in terms of the closest clinic available. And besides that, we run, like I said, 4 programs around the island that work with suicidal patients. So what we wanted to do is get it up and running as soon as we could. And it took us about 2 weeks, because remember, we're helpers, but we're victims too. And it's like the first days, it's myself, I couldn't get a hold of my patients. Even if I called them, I couldn't get out of my neighborhood because it was like all either flooded or we had like trees and power lines everywhere. So it was really hard. There was no way to get to them during the first 2 weeks. But what we've done is get our clinics up and running, and then like open up in the, when we went to the mayors and the shelters, we talked about the need, and we identified different areas that needed like more assessment in that particular areas of substance abuse and suicidal ideation. So what we did is we set up tents to do some assessment and to get we've gotten information in terms of the needs. So now we're going to push through with some sort of treatment. The problem we have is that the major needs are in Vieques and Culebra, which is our municipalities that are little islands out of the main island. So it's tougher to get there. And that's the main reason they actually need more help over there. So we're working on setting some like, part-time clinic over there. And that's what we've done. Also, we have some colleagues that and remember also like offices and clinics were wiped out by the hurricane too. So we have a major clinic in San Juan that works with dual diagnosis, and they just set up their clinic outside the hospital with tents to get back back rolling and get started again. But we're doing everything we can, but we don't have like right now the system is the mental health is not coordinated at all with the Department of Health. Now they're talking about doing something like hiring more social workers and psychologists, but it's not that fast though.
I just want to add that most of the psychological and or psychosocial services that are being provided are provided on a voluntary basis. It's us working as volunteers, members of these teams, not working as part of the health department. But now universities, in this case, Universidad Carlos Albizu, Domingo is a professor at the university, and some of his students are part of that voluntary effort. My group of students at the University of Puerto Rico, Francisco, who's a student here at Universidad Carlos Albizu, now Patricia, we also bring a group of her students to communities, but these are all voluntary efforts. We are not being paid, or this is not part of a plan developed by government agencies. And I don't know if Lionel wants to add something about that kind of work in New York.
Here in New York, it has been more organized when it comes to receiving Puerto Ricans to the States. As I mentioned earlier, of course, the New York City Hospital Corporation is admitting patients as a priority. So this is also really important. But when it comes to suicide ideation, for this patient who comes Puerto Ricans, who happens to be already here in the States, we strongly suggest to go to the emergency hospital right away. There's no thinking about it. They will coordinate the efforts afterwards. Also, here in New York, you can call 311. Also, they also will provide, this is a line of, it's a help line that they can call in any language. Spanish is also, they are willing to also help when it comes to organizing the efforts and help those patients. Also, Thrive NYC, that's a 24-hour line specifically for suicide interventions. For substance abuse, the same procedure. I have also some options. If you are also, we can talk about it later on. The Lower East Side, we have a few facilities that specifically like Olitas is in the Lower East Side. Spanish population, they can work with that population as well. Of course, we strongly suggest to go to the first line is going to the hospital system. They already know by the city, by the Espacio, they have a commitment to open these services specifically for Puerto Ricans. So this is
and aside from the 311 and New York City Drive, we also have the New York City Well.
Oh, yes.
That's a crisis line. Yeah, it's a crisis line 24/7.
I like that.
I just wanted to say that Domingo wanted to add something here.
Yeah, I'm sorry, I forgot that September is Suicide Awareness Month for us, and we had a bunch of activities planned and mainly awareness and talks in different universities. We go to radio show, we go to a television. So since we got like 2 hurricanes in a row, yeah, it was difficult to do that. But we have we're gonna do it in November. We're gonna do it like in right now in November. We're gonna do it, and we have some T-shirts we're gonna give like to every student with information in terms of what to do if you feel suicidal and stuff like that. It's not that easy just to tell them call this number or this line, because you know in the rural area especially, the most damaged and isolated areas, there's no phone service, no service at all. So it's really hard to tell people to call. But we're gonna do some regional radio broadcasts, because those people in the rural areas, we know now that it's some AM radio stations, and they have like the battery radio, so it's better to get information out that way. So we're gonna go to different towns that have no service at all. We're gonna do some prevention programs there. That's the kind of things we can do, because you know, telling them to call or lines, we do have prevention lines, but you know, the people that need it the most, they have no access to it.
And I should also mention that this Universidad Carlos Albizu, just started a program today. They're actually today in Maricao, that they will be visiting some rural areas, house by house, a team of psychologists and psychology students to provide this psychosocial attention at home. Any other comments there?
Blanca, yeah, there's 2 members, 3, member 4, member of the audience.
Yeah, how open are you, psychologists and sociologists, to the alternative therapies like yoga, Reiki, Qigong, and all those things that have been proven that help a lot people of any type of situation? And I have a friend that told me she had 2 brain surgeries, and the doctor told her, I'm going to take you to a place in the hospital that is for rich people. But because I like you and she used to work there, she took her and they gave her Reiki. So, because I'm a Reiki teacher, so she came to me to learn, and she has continuing that. And there's a lot of therapies that at this moment, with this urgency, people need to deal with their energy. It's not religion, it's not, you know, any other type of alternative, but people have to start to deal with that, because drugs cannot solve certain problems.
Let me go first, Blanca.
Go.
We have, in fact, I was in, there's one group that I was organizing when it comes to alternative strategies, just like that one. Yeah. And in fact, she is traveling to Puerto Rico on November 8th. So she also, along with other many Puerto also here from the diaspora, they have been keep sustaining meetings here to organize And yeah, you're right, of course. You know, alternative, of course. Psychology was later on implemented. So I totally agree. It's okay. Everything, you know, and depends also and the profile of the population as well. You know. So yeah, it's more than welcome, more than ever. So yes, I think.
Yeah, I'm the volunteer to work with you.
That would be amazing. Yes.
So yes, I know Blanca. I know that you want to provide an answer also.
Yeah. Well, over here, we do have some efforts. In I know, for example, of some people are doing yoga classes for free. But that's mainly like in the metropolitan area when power has come back and you know, you have some communication. I haven't seen any of that in the most isolated areas. And again, I'm not opposed to it. I just think that in those areas, we first need to talk about food, water, safety, medicines, opening up the roads, because I want to be clear about that. Most of Puerto Rico is without power, without communication still. So getting that over there is also important, but it's a bit harder. And I know that after they get their food and water, yoga class and something like that would be awesome for them. That's something that I wish I could do. I'll take anyone that wants to do it. I'll take them over there. You know, after they're safe and they have their food and water. It's awesome.
Yeah, we're still trying to fulfill fundamental needs or basic needs. Yeah, we're still on that phase in many parts of the island. So you know, definitely getting food, water, cleaning the roads, that's important, or that should come first. Also, in terms of psychological services that you know people are receiving, they're more focused on, you know, short interventions to de-escalate situations, you know, listen to people, reduce stress, because of the lack of access, because of the lack of other fundamental needs, time, there's many factors that really hinder our ability to provide that type of alternative means that do work on a constant basis.
There's a group in the south of the island that they're like 4 or 5 doctors in clinical psychology, and they also work with therapy dogs. They're trained, and I know they've taken them to shelters, and they've also taken the dogs to some sort of isolated, like half of the isolated towns within the south of the island. So there are people working on some of that too.
There is older.
Janelle, there were more questions.
Yes, 3 questions, but we have 15 minutes, right? Yeah. Okay.
Yeah, 15 minutes.
I have 2 quick questions. One is, how can we support the efforts that are happening? Because I know that we're here and you're over there, so I really want to know, how can we support you in Puerto Rico during this time? Are there any groups that are coming from here that we can tap into? Is it financial? Is it, you know, like, tell us what it is that in the psychosocial perspective that we can help you with. We know that food and water and shelter is primary, but, you know, if we could get the psychosocial part going too, would be great.
Yeah, I think that the best thing would be to get in touch with organized efforts already, as those we've mentioned here, the one that is being organized by the College of Physicians and Surgeons. The Puerto Rican Psychological Association has also been offering support and help. The clinic at the Universidad Carlos Albizu, the University of Puerto Rico at Rio Piedras, and their clinical, the clinical services they provide. So there are some organized efforts, and the best thing would be to get in touch with these, because they're already running and they know what the needs are, where are the most underserved areas, and all the help that you could provide in these psychosocial areas will be more than welcome. Leonel has our phone numbers and email addresses, and he can provide it to you when we're done, and you can get in touch with us.
In New York, I want to say that over there in New York, there's a group called Love for Puerto Rico. Love, and the 4 is the number, and then Puerto Rico. And I've worked with them. I trust them, and they brought a bunch of voluntary doctors, social workers that were great. They did an amazing job, and I think they already know in terms of the needs. So you can get in touch with them. They're trustworthy.
And also, I forgot to mention a group called Salubristas for Puerto Rico, and they are being organized by colleagues at the Escuela de Medicina of the University of Puerto Rico. So this is a group that I mentioned just a few minutes ago, that they're now beginning to provide attention and services house by house in the rural areas. Leonel?
I'm sorry, yeah, another one? Yes.
If I may, first of all, every time I think about it, I'm thinking about what's happening in Puerto Rico and what's happening here. And I'm here, and I will be able to do something. But one of the concerns, I think you gave an excellent point, outside of the concerns of the water, electricity, all that. You have to think a lot of other things. It's a list. But in this issue where they have like, you know, the yoga, that's something we should all do, because we have a big task coming to all of us, and we got to keep cool and do our exercises. So in terms of our recommendation, if it's possible, to circulate this idea. And also we have places when you go to the YMCA, that maybe the YMCA could open a door for situations Puerto Ricans come in here, and they can go to a place, you know, breathe, you know, yoga, there's a pool, exercises, because don't forget, we have to give to the message to everyone in New York that Puerto Ricans, not only have we been wonderful people, it's also, this is the moment that Puerto Rico is gonna like wake up and say, yeah, and we can do it. So this is so many things that we can do, but like I said, I applaud the professionalism of coming here, because right now what they're doing in the Center for Culture here, we're mentioning about this, I took a picture. I think it's fantastic. My question is, how can I help? How can I support you guys? Because you're doing the professionalism. But I think that every Puerto Rican should become an advocate to do something next door, clean the little door, do something. And I think, please, in presenting the proposal, that there be a place for the issues of these modern techniques of coming to Puerto Rico and feel welcomed, okay, and feel with the reality of the freezing cold water, cold, you know. And of course, I didn't even think about this when I was volunteering a lot. I said, I just thought about it. I said, wait a minute, hold it. There are Puerto Ricans coming here. We got to volunteer clothes, t-shirts, coats, hats, everything too. So to keep in mind to the message that whatever we're sending over there, we got, wait a minute, hold it. We got to come some, you know, coats, you know, and make them, and if they have a place that we meet them. I want to meet my people from Puerto Rico. I want to let them know, hey, you're not by yourself. When we go to the next Puerto Rican parade, we're going to march real strong, and we are not by ourselves. So like I said, my excitement is such in the question that this is the moment that every Puerto Rican has a responsibility, okay? Something shaked us real hard. Just, oh shit, you know? And everybody's watching at us. Everybody is watching us. And we have to do so, the solidarity and the unity. And like I said, we need help in terms of these emotions that we do have in silence. But we have to be outspoken. And in conclusion, because I could go on and on and on, I think, you know what? I had this wonderful sheet. I went to an organization of mental problems. I don't have it with me, but I will try to give it to you. And it was a list of, you know, I call American, you know, who get real services for people for mental problems. And when I read that, I said, oh shit, this is really good. 10 ways to become an advocate. And I will present as a proposal when I presented to the Center for Puerto Rican Studies, that when I gave them that sheet that I don't have this moment, it had 10 ways to become an advocate. And I feel in my heart that every Puerto Rican should become an advocate. Be in the issues of health, talk to your neighbors, talk to you gotta be involved, because it is a responsibility. So everybody, we should send a message. And I say that because when I started coming here to Center for Public Studies, it's because when I heard the bad news of what's happening of the crisis, and before it was different, you know, when they talked about this, I said, "Get that." They know me. So if I come here 3 or 4 years, it's the question that this is the moment. And like I say, everyone will over here, this is the pueblo de Guayama, which of course I would like to know what you're doing for my town. Yo soy de Brujito.
I've been there. I've been to Guayama.
Soy la dama de Guayama, con el mensaje de ustedes, con el espíritu que yo tengo, tenemos que levantarnos. En historia, ¿qué hicimos? Hicimos algo. And we're going to do it. Everybody, the Hispanic community is looking at us. And we have a lot of support from every different country are coming to say, hey, what can we do? What can we do for you? So we have to take advantage in the way that we're going to alight and say, we got the power of the people. And we got it. Anyway, I can Right move on. now, we should start to organize a cold drive because the weather is here already. The winter. Oh, yeah. And people will need coats. So we can, you know, start organizing that.
Let me just pass this so you can write down your.
Is it possible if we can create a list
Yes.
where we can come together and maybe start creating committees that can begin to work on different aspects that they're interested and that they have areas of expertise in
Yes,
that can help the Puerto Rican community?
If you want, I'm gonna have this so you can write down your name.
Okay.
So also I'm gonna change that information with Blanca, people in Puerto Rico, so they can organize.
Puerto Rico, you got it.
There's one last one?
Okay.
Yeah, yeah.
I'm a psychologist. I'm a professor at Brooklyn College and also a member of the APA Minority Fellowship program. And I visited both Albizu and the UPR last year. Impressive programs, incredible work that you're doing. My question is, where's the Red Cross in this? Because I actually reached out to both the APA and the Red Cross, and I have an email, and they said to me that they have the unique needs, because I asked about the bilingual, bicultural piece of Puerto Rican mental health, and they responded to me that the Red Cross has that handled by the existing clinicians in PR and by volunteers from the states. And I just want to know if that was the case.
We have different responses. I haven't seen the Red Cross nowhere where I've been. Domingo.
There's the main government. It's working out of the convention center here in Puerto Rico, which is a big place, and they have a 3rd floor where you can't get to because of security. We usually.
But you cannot.
Yeah, well, I usually went to the 1st floor where the soldiers were and the reporters were, and that's when we went out for the missions. But usually the Red Cross is with FEMA on the 3rd floor, talking about what they're going to do instead of doing. So we didn't see anything in the towns that I went to. And we went to, I'm talking about more than 30 towns. The most in need. I saw a helicopter once that's supposed to be the Red Cross, but that's it.
I've seen very little presence, but what I have seen has been voluntaries with their Red Cross jackets building small care packages. And I'm guessing that the helicopters are to deliver the care packages, but
those voluntaries are from here, from Puerto Rico.
Yeah.
That go and take like a course in terms of psychological disaster intervention that the Red Cross gives for this, but that's
other than that, I've seen no presence.
Well, I'd like to reach out to get your information, because that's totally not the information. I asked specifically about mental health, and they told me it was covered.
What in line?
I also have her contact, and they told me the same. They're not organized, so
I think there's some advocacy to be done on the part of the.
Well, how about people, but you're not even asking.
Patricia.
Leonel, I would like to, I'm very curious about the woman of Guayama.
Yes.
The proposal of the 10 actions to become an advocate. For me, it's very important that she can send to us that information. And also, I haven't heard about the Red Cross. So
can I make a comment to the Red Cross?
There's 3 minutes left. I don't know. After her.
Okay, just about the Red Cross.
So I'm going to mention something briefly about the Red Cross as well. I'm not talking in any way on behalf of the city, but I've been staffing the Julia de Burgos Center for the last couple of days. There is a station of the Red Cross there, and they're the ones doing the medical checkups. At least at that pace. So I'm talking stateside of what that they have been doing. Something that I wanted to say is that if you really want to get involved, please think of the people that are moving here. It's very shocking, and this stories repeat every single minute. It's not something that is like one day after the other. This is something that is happening, and it's very real. And the concern right now is the children. Bless you. When they come there, this is a pretty traumatic center. This is people that are getting to the States the night before and coming to the center. Trust me, this is not easy. They go there, there are different city agencies, but there are a lot of limitations, and you all know that in terms of resources, there are a lot of things that the city cannot provide. My suggestion is for you to get acquainted in terms of what is happening in that center, because one is very beautiful because this is like a historical event. Yes. It is historical in the sense of what is happening there. These are newcomers. There are like technically refugees, because there's a tent outside where they wait to get served. That's why, and this was the motivation of this center, because we're trying to humanize the experience of moving to the States, because in itself, it is very shocking. People are going through a lot of emotions. They have so many things in their hands and things that they cannot control. Specifically, something that we have realized, or that at least I was able to address there, is that a lot of students are leaving everything behind, like senior students we're talking about that left everything and are coming here, and they're trying to figure out what is that they're gonna do next, but already like almost to when they're about to finish their careers. So I would worry you. I know that like situations in Puerto Rico are very much dire, but I would encourage you very deeply to care about those that are here. They're leaving, they're doubling up in places, they're sleeping on the floor. It is like super, super sad. So please, please, please don't forget about those that are coming.
Is there a place here where they are living or something?
That is the situation. So in terms, the city has not, and as I said, I'm not talking on behalf of the city. I work for the city, but I'm not authorized to talk on behalf of it. In terms of shelters, you know that there's like a whole structure in terms of like shelters in the city. What they're doing is that they're staying with their families. But remember that space in New York City is very limited. So like they're doubling up, they're staying on the floor or whatever. But we're talking about there's now 7 people in a 1-bedroom apartment. That is unbearable. And like people continue coming because as they don't see like the electricity is like coming anytime soon, they just continue sending people here with the hopes that things here are going to be better.
Have you heard anything about
I think we should, sorry, but we need to finish because they have another session. Yeah. After this, if you want to keep talking amongst yourselves there, I really appreciate that you attended this session and that you are so energized and with so many suggestions and proposals that I would encourage you to follow up. Thank you, and I hope there is a next time.
Thank you.